Thank you, Team Drishti, for having me here. Thanks to Amadip ma'am, Dr. Shivam. So I'll be speaking on GATT the right way. So GATT, the gonioscopy assisted transluminal trabeculotomy, was introduced in the year of 2014. So it has been 12 years since GATT was first introduced. So it is a conjunctival sparing ab interno procedure which does a 360-degree goniotomy using a Prolene suture. So this is the economic efficient option. Instead of the microcatheter, we can use a Prolene suture. So I'll be simplifying my talk. So having so many options of minimally invasive glaucoma surgery, I have split my talk into just 4 categories: why to get, when to get, how to get, and the precautions. So let's deal with the how to get part first. So this is a short video. So sir has spoken, Dr. Amit sir has shown how to do the head tilt, the microscope tilt. As for every minimally invasive glaucoma surgery procedure, this is very essential, especially for GATT. So I'll pause here a moment. So before preparing the suture, what here I am trying to do is measuring. So you have to have a measure of the suture so that you won't end up with a short suture or a large suture. Next is the forming of the, I'm sorry about that. Can you play the videos? So after measuring the suture, the mushroom tip, this is the next very important step. Having the mushroom tip, the proper sizing of the tip is very important. Next is the goniotomy, identifying the Schlemm's canal. This is a very crucial step in which most of the novice surgeons struggle. So this is the why the GATT is having a greater learning curve. Once you are in the canal, thread it slowly in firm movements. No need for any unnecessary movements until it reaches the circumnavigates the 360-degree. And this is the wow moment Shivam was talking about, the seeing the other end of the suture, and then the 360-degree is ripped off. So while making the incision, the side port for the GATT, you should be making the side port facing the angle so that you can pass the suture in the right direction and not in the opposite direction, and avoid bleeders, otherwise the bleeding will be seeping, and keep the suture ready before even you go for the microscope tilt. Next is the very, very crucial step of the sizing of the mushroom or the umbrella tip. If you have a very small tip, you are going to have a resistance or your suture is not going to circumnavigate 360-degree. However, with a large tip, this is much more dangerous than a small tip. You are going to end up with a false passage. So this is very, very essential, especially in cases of GATT, because you are going to have a 360-degree opening and the chances of hyphema is much more compared to any other goniotomy procedures. So that is how to get. Now let's go about when to get. So we have seen the circumferential procedure and the segmental procedures. So this is the reason why we need a 360-degree procedure, because we don't know. We saw beautiful videos of trypan blue percolating, but do we know which segment of the outer collector channels are actually working? Is the temporal angle actually working? So we are removing 80-degree, 90-degree, 120-degree. So with 360-degree, it maximizes the chance of connecting with the healthy distal collector channels. So identifying a distal healthy collector channels is very difficult with the segmental goniotomy. Apart from that, the economy. Ma'am spoke about bang, which is economic. GATT is another economic efficient option with the Prolene suture and with very minimal instruments needed. It is cost effective with faster recovery, once again lesser post-operative visits with a meaningful control IOP. This is one of the first publications of ours of early outcomes of Prolene GATT in our Indian population. We showed a complete success of 96.7% when combined with phacoemulsification, and standalone GATT had a 91.7% success rate. And both had a good significant intraocular pressure reduction as well as anti-glaucoma medication reduction. So I would like to highlight one more study. This came in AJO in 2025 January. This is a meta-analysis which compared various MIGS procedures. So if you see here, look closely here, this is the intraocular pressure reduction chart. The control group is just phacoemulsification alone, which had an IOP reduction of minus 1.84. But when you do a trabecular meshwork bypass procedures, how much additional IOP reduction you are getting is this much. And when you are going to non-GATT goniotomies, minus 5.24. But when you are going for GATT, it is around close to 10 millimeter IOP reduction you are getting when combining with phacoemulsification. Similarly, when you are having an AGM reduction with the control, that is just phacoemulsification alone, is this much. When you go to GATT, you are getting an AGM reduction of 2.13. So GATT works well, GATT works better than other goniotomies in terms of intraocular pressure as well as AGM reduction, without any doubt. More than that, it is a versatile procedure. We can go on around exploring the unconventional indications once you have mastered the conventional indications. So these are certain unconventional indications being tried. So this is a case of GATT done in angle closure glaucoma. Like any other MIGS procedures, first goniosynechia lysis is being performed. Then identification of Schlemm's canal. This is once again the crucial step. Once you have identified the Schlemm's canal, then you pass the suture. When it comes to open angle versus angle closure, the difficulty is circumnavigating the suture, because you are going to face more resistance when it comes to angle closure. So this is once again our results in juvenile open angle glaucoma. We had a significant intraocular pressure reduction and AGM reduction. Success rate was 72.7% in mild to moderate. Our success rate was better in advanced, 73.7%. And this is a common case scenario which we face in teaching institutes. So there was a deep cut in the trabeculectomy flap. And what do we do? At that time, most of the times before MIGS came into being, we used to close, just do a phaco and close. Now we have these MIGS options. So we went ahead with the GATT in this deep cut trabeculectomy flap. So this is another case of failed incisional surgery. So you can see the fibrosed and the failed bleb here. He is a 50-year-old male who was working in SHIP with uveitic glaucoma, underwent trap, bleb needling, 35 millimeter mercury and 4 medications. So in this case, again, once again, a Prolene GATT was done. And right now the patient is free of medications with an intraocular pressure of 10. Once again, when you are attempting to do in such cases, identification of the Schlemm's canal is very important. Next, start away from the side of the fibrous bleb. More or less there is going to be synechia on the area of the bleb. So if you start away, you can have more coverage. Even if you don't get a 360 degree, achieving even a 270 degree is good enough in such cases. Even if you don't get a target IOP, freeing him of medications. He is working in a SHIP. He doesn't want to put 4 medications with the 35 IOP. So this is a very good procedure in such failed trabeculectomies also, relieving the patient of medications, getting a good IOP control. So the precautions, yes, this is the most important thing. Hyphemas are the most common complications of GATT, mind you, because we are opening up the 360 degree, so more chances of hyphema. However, 90% of these hyphemas are transient and they resolve without any intervention. You just have to watch for some time. Yes, macro hyphemas that requiring wash is also there, but have little bit patience. IOP spikes like any other MIGS procedures, GATT also has. So for beginners, you can have a look at this, was published in October 2022 in IJO videos. And to summarize, yes, mastering the art of intraoperative gonioscopy is the key and first step. And as everybody spoke here, start off with limited goniotomy like microhook or bang or KDB before attempting for GATT, because GATT does have a learning curve. I would like to take a moment to appreciate my mentor, Dr. Devendra Maheshwari sir, who taught me GATT, and it is indeed a privilege to speak on this topic in front of him. Thank you. Thanks to my entire team at I Foundation Vellore as well. Thank you.